Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Weaning.
And I'm Dr. Paul Zalza. And
I'm Nicole Callan, Dr. Nicole Callan.
Thanks for being with us, Nicole. Today's topic is, I have blood in my stool. What now?
serious topic.
Yeah.
Very serious.
And very, very common. So people are at home, they either go to the bathroom and look on the toilet paper or in the toilet and something doesn't look right. So then
want to watch this video. Watch this video to the end so you can figure out what to do in this case.
it's important.
And just so that you can understand how to approach this kind of finding.
So Dr. Callan, how do you start with these people? Someone comes in, tells you that story.
Yeah.
What kind of questions do you ask?
The first thing I'm going to ask is, what was the color of the blood? Was it red? Was it purple? Was it black? And then it's quantity. How much blood was there? Was there a teaspoon? Now it's hard to quantify as well, because if you're having bright red blood going in a toilet, it's going to look very dramatic, and you may think you're bleeding out, but it may not actually be that much. So it's hard to get that quantification. Pictures are helpful, and I've seen quite a few pictures, so that actually helps us just to determine how much blood is coming out.
And the reason that you're asking that question is because you want to know where the blood's coming from, correct?
Well, and also you want to get an idea of how much blood people are losing. Are they,
Yes.
are they in trouble? Do they need to be going for blood work to see how much blood they've lost? Is their blood pressure going to drop? But because you could have a lot of bright red blood coming from your stomach, in which case you'll probably get dizzy and pass out if this is an ulcer. Whereas if you have just hemorrhoidal bleeding, it's going to be very dramatic, but you're not going to have the dizziness and the, well, you could if you have a lot of blood. But
That's a great idea though. Just snap a picture of it. I mean, you don't have to make it your screensaver or anything. Just take a quick pic, bring
pictures
it to the
are
doc.
so helpful. And we don't judge pictures. We love pictures. Pictures are
never
great.
thought of that. Okay. So your patients come in to see you, say, I got blood in my stool. Maybe they have a picture of it or not. What's your approach to that?
So first I'm going to get a little bit more history from them, their past medical history, if they had hemorrhoids, have they had fissures, have they had a colonoscopy, what's their family history, and then we're going to do a physical examination. So after the full history, getting more information, then it's physical exam, starting with just an abdominal exam, looking to see, are they really pale, do they look like the sheets, do they look like the walls,
So if they're pale, it means they've lost a lot of blood, lost a lot of hemoglobin, so they might be anemic at this point.
And then we're going to do a rectal exam, because that's a key piece to that examination.
All right, a lot of people are worried about that. We were talking about this earlier. People are embarrassed to have that kind of thing done, but it's really an important exam when it comes to making a diagnosis in this setting.
Absolutely. Because you'll know when you're doing the rectal exam. So when we do a rectal exam, we're not looking, we're not judging, we're just getting information. So it's all about data collection so we can come up with what's going on. So the first thing we're going to do is look, okay, do I see an obvious big hemorrhoid there, or do I see a fissure? And sometimes if you have an anal fissure, which we've talked about before, I won't even be able to touch your bum because it'll be so painful. But generally, if I can do a rectal exam, I'm going to be feeling for tumors. Hemorrhoids, you can't really feel hemorrhoids, but you'll feel like, some cushiony kind of plumpness to the anal canal. But you're not going to actually feel anything specific. And then you're going to see how much blood is on my glove. Is it lots? Is it purple? Is it black? And that's going to help kind of steer me in the direction of what's going on.
So help our viewers out here. You mentioned the color a few times. How does that tell you what's going on, the color of the blood?
Yeah, so color, generally we'll say that the darker the blood, the higher up it comes from your intestinal tract. So bright red blood, unless you're bleeding quite aggressively, will generally be from hemorrhoids, fissures, lower things right near the rectum. Whereas the darker blood, so the longer the blood is in your system, it has time to kind of change and get darker. And so usually that would suggest something from upper abdomen, your stomach, small bowel, maybe the right side of your colon.
Okay, so what's going through your mind now when you see a patient with blood in the stool? What are the main causes? What are the main causes of blood in the stool?
Like a top five.
Top five will probably be your hemorrhoids, fissures, and then of course you want to rule out colonic polyps, colon malignancies, ulcers. Those will probably be, is that five?
Yeah.
So blood in the stool can be something that's really benign, like a hemorrhoid or a fissure?
I would say more commonly benign, but you need a full workup too. You can never accept benign You cannot call it benign until you've done your full workup.
So it can be it's probably something benign, but you have to rule out something bad that could be going on, even though that's very unlikely.
Yeah.
Or more unlikely. Okay.
So now that you've done that part of the physical exam, are there any other special tests, like in orthopedics and other times we've talked about special tests? Do we do an ultrasound?
No, so I'd probably just start with some blood work, see where the blood level is sitting at, and then plan for colonoscopy, maybe a gastroscopy, so looking in the stomach and the colon as well, depending on what I got from the history.
Separate sessions for the camera.
What camera?
The gastroscopy and the colonoscopy, different camera. Yes.
We start with the stomach.
There we go. Okay, so you've done that, and so if you don't find anything obvious on those two, yes, you can see an ulcer, you can see a lesion of some sort. What if you do those tests and you have the bleeding and now you still can't find anything? Does that ever happen?
Yeah, it does. I would say it's relatively rare, but some people could have bleeding that just subsides and you'll never actually know why they bled.
Okay.
But you can, depending on your index of suspicion and concern for something else, you can order more tests like a CAT scan to further assess the small bowel, because that's somewhat of a blind spot. You can't actually easily scope the small bowel, so that would probably be the next step if you're really worried about something in there. But those would be more unlikely causes. So.
Okay, so let's say I'm a viewer at home, or I'm at home, I've gone to the washroom, I see blood in my stool. Should I see the doctor right away, or should I say, no, this is something I can walk off?
Yeah, so I don't think you need to panic. But I think it's important to have an assessment. Now, if you are feeling that this is a lot of blood and you're worried, then obviously the smart thing to do is to go to Emerge or to your family doctor right away if you can get into your family physician. That's the best.
So large amount
they
of
know
blood,
you best. So
large amount of blood, worrisome because you could be losing hemoglobin and you could become anemic. Small amount of blood, get it checked out, but you don't have to drop everything. Before you go see them right away.
Somewhat use your judgment, but if you're really worried, then see your.
And like we said before, it's really important not to be embarrassed. It is a sensitive issue, but you are going to require probably a digital rectal exam, which is the DRE, not Dr. Dre. It's a rectal exam, but it's an important part of it, and avoiding it often can complicate the problem, particularly in the cancer side of things. If you delay or you wait, it could potentially affect your prognosis, so address it for sure.
Yeah, and I mean, look at your stool after you go to the washroom, look at it. I mean, you don't got to sit there and admire it and be late for work or anything, but take a quick look and make sure there's no blood in there. And if there is worry, take a picture. It doesn't have to be a selfie with it, just a picture you can bring in to the doctor to show.
Yeah, we love pictures.
And then obviously treatment regimens will be really specific to the pathology. So there's going to be a bunch of different potential treatments that we probably can't get into today. But yeah, do what you're told. Follow up carefully with your family doctor. That's probably that. Anything else, Dr. Callan?
Yeah, no, I think that's about it.
Thank you so much. We know how busy you are. I know when I came in this morning, you were cornered by some people asking about their own diarrhea, and you just sat there and took the time to explain everything to them, even though we had to film.
Hoping to find a cause.
There you go. So if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.